Hello, everyone. Welcome to my Healing Around the World project. My name is Dr. Alice Fong, and today I have the pleasure of introducing my good friend and colleague, Dr. Diana Hubbard, who is a naturopathic doctor who also graduated from Bastyr University. She previously worked in the biotech field with tissue transplantation and also completed training as a professional massage therapist. Post-graduation, she worked as a consultant at an integrative pharmacy while instructing students at a local massage school and continuing to TA classes at Bastyr, along with tutoring those individuals who needed some extra support. Driven to further her education, she applied for and completed a 2-year naturopathic residency at Progressive Medical Center in Atlanta, Georgia, working alongside dietitians, medical doctors, nurse practitioners, and an acupuncturist and chiropractors in a functional and integrative setting. She is passionate about helping patients identify the obstacles to their health and guiding them in their treatment plans to achieve the best possible quality of life so they can live their life well and happy. Please welcome Dr. Diana Hubbard. Welcome, Dr. Diana. How are you doing?
I'm doing wonderfully. Thank you.
Oh, good. Thanks for being part of my project.
I'm excited. Yes.
Oh, great. Excellent. So let's get started. Tell me a little more about how you got into naturopathic integrative medicine.
That's a really good question. I can't speak for everybody in our profession, but many of the folks that I came across in our education had a similar story. It was either something that was very personal to them in their own health journey, I think, or close to them, whether it's a family member or friend that was touched by this type of medicine. And I think this type of support, it's a whole different perspective on looking at health and wellness, and that was my journey. I was very ill at one point in my career and wasn't really getting anywhere from a traditional, what we might call a traditional pathway, going to multiple types of doctors, knowing that I wasn't feeling well, knowing that I was suffering from chronic fatigue and many other issues, a suppressed immune system. I chose to seek out another path for helping myself recover from that. And it took multiple years to do so, but here I am. That's why I chose the path that I chose.
Wonderful. What a beautiful story. And so you're based out of Atlanta, Georgia, which is, you're from Georgia. And what kinds of things do you see there in Georgia?
Oh, wow. So I work in a functional medicine clinic, as you said earlier, and so I see everything. I mean, we're not necessarily treating from a primary care perspective, although a couple of the docs I work with were trained as primary care physicians. We see a whole host of issues. Many people coming in for some basic things like weight loss, just wanting to focus on that aspect of their health, or hormone support. So we see many perimenopausal and postmenopausal women who are seeking health, and some men as well, seeking some support in that respect. But we also see some more significant conditions such as Lyme disease, chronic Lyme disease, autoimmune conditions, people suffering from sometimes uncontrolled diabetes type 2, and a lot of, in the Southeast is a big deal, a lot of mold toxicity, so mold exposure.
Okay. What's your approach to addressing mold exposure?
Ooh, it's complex. It's much the same as we might do with any of those conditions. First, basic, focusing on the basic aspects of health, healthy living, dietary. But obviously we have to examine the environment, especially if they're still living in that environment and having that exposure, trying to help find resources for dealing with that. In our clinic, we have a number of approaches we use, of course. Dietary supplementation is part of it. But we also offer IV therapies, high-dose vitamin C, ozone IV therapies that are very helpful. one of the focuses in that clinic is doing detox work. So there's a lot of gut work that goes along with that. We have in-house saunas, and a number of other things that are available that we help guide patients to find. Certainly cleaning up the environment is a big one.
Absolutely, definitely. And so you're working at a pretty big clinic with all sorts of different types of practitioners, like medical doctors, dietitians, massage therapists, acupuncturists, chiropractors. What is it like working in that type of environment for you?
I love it.
Yeah.
It's very collaborative. We have it set up in a certain way such that we present ourselves as consultants, that being the indies. And so there's a whole process that a patient goes through. I do carry my own, population of patients that come to see me specifically, that I've built up over the last few years. But we often do collaborate on patient care in cases, and are all the time sharing our experiences, sharing what we have researched ourselves as far as treatments that are out there, and what the latest information is about that. We actually exist in the middle of that clinic in a central location, so we're always putting our heads together to talk about cases and patient care. I love it. It's been wonderful because I've been able to learn from medical practitioners, the things that we didn't have as much exposure to. And that's awesome. And they learn from us, and they're excited to do so. Generally, the medical practitioners who find their way to this type of practice, there's a reason. They're wanting to help people also in a different way than is their kind of traditional training.
Awesome. Wonderful. And is there any particular things that you like to specialize in at this big clinic?
I do really like working with the women who are looking for support around that midlife stage. That can be a really difficult transition for women, and especially all that they have experienced in their life up to that point. Sorting through all that and helping guide them through that is really exciting when you see that pay off in a good way for someone. It's not, somebody comes in seeking support for hormones.
Right.
Well, we don't look at it like that. We're looking at the big picture. I mean, that's part of it, and we're going to help them with that, but we're also going to help them with the other, core pieces to what we think is healthy living. I enjoy that. I enjoy helping people recover from those toxic exposures, and those are some of the tougher cases. Lyme is a pretty tricky thing. Chronic Lyme is difficult and challenging.
What have you seen as far as Lyme disease goes?
We get all manner of folks in there, and they all come in sometimes a pretty debilitated state. There's a lot of neurological symptoms that people present with when they have chronic Lyme, and it's a very difficult thing to diagnose. And because there's not a really great way to do it from an allopathic standpoint, it's not, they look at it as it's viewed from that standpoint as just a post-Lyme condition, or a post-Lyme syndrome, which, that's not always the case, I think, in what we see. I think it's a difficult infection to treat, and if it's not treated, depending on the background of the patient, if it's not treated well or the initial treatment is not effective, it can often hide out and come back for those folks. So, and then some people were never treated at all and then end up years later having problems.
Right. It can go undetected for years without any issues. I've seen it
exactly
here in my practice. Yeah.
And it's pretty rough. It's pretty rough. I'm sure when people show up at that point, they're pretty, they may feel fairly desperate.
Right.
For help.
Right. Yes. And so as you know, the purpose of this project is to help people who don't have access to doctors and healthcare in general have a little window into the views of doctors and get exposure to that. So if you could offer any piece of advice to someone who had limited means and resources to be able to see a doctor who might not be able to come to your clinic, what kinds of things would you recommend for them?
That is always challenging.
Yeah.
I think looking for community resources, because I know that they're out there. I know that people will give their time. It's something I wish our clinic was able to do more, but those practitioners who are willing and do.
Mm-hmm.
Sorry about that. I think is a good idea. I think even when you don't have necessarily the financial resources, I think there's things that you can choose to do that are supportive of your health that are available, even if it's a free app on a phone, or if it's adopt meditation practice, or doing things that, because stress is tremendous. I think one of the hardest things to address in our culture is how stress affects all of these conditions that we're talking about, right? Or affects all of our body systems and sets us up for these diagnosable conditions.
Mm-hmm.
So addressing how, I think there's a lot of free ways to do that. You know what I mean?
Mm-hmm.
Addressing how you respond to stress.
What kinds of free ways would you suggest?
Well, I would be willing to bet that we still have access to library books out there that have information that you can read about that is going to be at a low cost. Mm-hmm. Looking for also support groups, depending on what's going on for somebody. I've seen that be a very powerful tool for people. Mm-hmm. Being able to, if they're able to access that, finding support groups for any particular condition that somebody might have. Right. Because that's free. That's just people, that's community, people coming together and supporting each other. It's also a way to find those resources that may not seem as accessible. I know that there's co-ops that are available depending on what city people are in when it comes to, say, trying to access better options for food. Trying to sit down and look at what you can do and what you can't do. Obviously, not everybody can go and say, oh, I'm just going to start eating 100% organic today, and I'm going to throw everything out in the cabinet, helping people find ways to, and that's where our dietitians are actually at the clinic I work at are extremely helpful. And I think any dietitian who's in this type of, or has this type of focus is helpful at helping people be able to eat right, eat well on a budget, that sort of thing. All of those core pieces, I think it's important to have. It doesn't cost anything to walk outside and breathe some fresh air and feel the sun on your face. And that can be tremendous in affecting how we feel and what our mood is. It's those core pieces that we learn in school. I think it's a good place to start.
Those are great suggestions. Yeah. Getting outside and getting some sun, definitely.
Yeah.
Wonderful.
Yeah. I know. Yeah.
I think we all need to be doing that too, even us doctors, probably.
Oh, I definitely do.
All right. Well, Dr. Diana, thank you so much for being part of my project. I really appreciate it.
Yeah. I've enjoyed it.
Oh, good. Well, thanks everyone for watching. Please share this video and spread the word about healing around the world. Thanks.